Good morning. I am Dr. Prasad, BN, a senior consultant neurologist working at the Fortis Hospital, Nagarbabi for more than 6 months. Today I am going to talk about epilepsy, a common neurological disorder which is either overdiagnosed or underdiagnosed. It's a common problem because it is a ghastly event that can make a patient very perturbed and also the attendants. And it not only is ghastly to look at, it can result in falls and injury. That is the major type of motor seizures what we are talking about. There are other type of seizures which are non-motor seizures. They are often called sensory seizures or complex partial seizures, where there could be disturbance in the level of sensorium even without a fall. There are other minor type of seizures which are seen more commonly in the childhood. They could be called absence seizures or a small myoclonic seizures. Unless we categorize these seizures into the event, the treatment and investigation may not be appropriate. Often many of these minor seizures go unnoticed by the parents or the attenders, which could happen once in a way and which may not get repeated. But the major seizures, which are the motor seizures, get noticed very fast and they are brought to the doctor either at the emergency or for an event which could have occurred few days back or few weeks back to the neurologist. They are often not approached properly by the general practitioners, so it needs a neurologist who could interpret and based on the history and the corroborative evidence could make a probable diagnosis of epilepsy or a seizure. If more than 2 seizures occur, then it can be called epilepsy. And the treatment is to be done after certain basic investigation, which include blood investigation, a neuroimaging study, either with a CT or preferably an MRI, mostly in the urban setup, and an electroencephalogram. Many a times, based on the history, it's rather difficult to conclude that this patient could have had a seizure or an epileptic attack. In that case, a video EEG would often help, which is done in few of the centers these days and interpreted, which could help us say that these sort of repeated attacks could be seizures which could be so subtle that often go unnoticed. And based on this, a patient needs to be treated either in the form of